trying to think. It was something else. Like I felt like I was getting a cold, and then the next morning the cold, like I feel like I was getting a cold, so I started getting nervous. Right up.
You did.
It was weird. It was just like weird, like my body went through.
Okay. Okay.
I felt warm a little bit, then I got hot mouth. Like my mouth started getting dry.
People talk a lot of trash
I
about
started drinking a lot of water.
They do.
My mouth got dry at night. That's crazy. I made my throat hurt.
How long you been here?
Then,
So I ain't getting the shot yet.
Okay.
No, I get it.
It's like a lump right here.
Yeah, so one of my lieutenants has a lump under his lip. It's a lymph node.
Yeah. That's why I knew.
That swelled up, but I don't have anything now. Nothing other than pain. Yeah.
So most likely I will have the office equipment literally on that step next to the pole, and then you can have it in the step that I use. It's close to him and to the other professionals in the office.
But
Well, I'm gonna love y'all from the inside.
it's interesting, like,
Wait a few minutes.
Yeah.
Okay.
That's like the pride.
I just got back from Florida.
Oh.
I know it broke. It broke on me. That's why I was in there trying to figure out.
Right.
And he caught me walking around in the corner trying to. Yeah, I was like, look, this is not what you think.
Yeah, it's so wonderful. Like we're really starting to think about putting some roots down here. Hope to match here. It would be nice to stay.
Council is there now.
I direct our emergency department, so so residents, when medical students come through, well, and there's been a couple actually the other day. So there's not a lot of Hopkins is notorious. So we definitely
Hello, officer.
How are you?
There.
I'm sure.
Hello, how are you? This is Vernon.
How you doing? Good morning.
You want me to hold your purse for you? Of course.
So we should be good.
Yeah, do you guys, does this work for the shot to have everybody here?
Is it okay if chairwoman goes right here? Is that too close, or maybe right there? Yeah. Is that good?
Are you guys all ready?
We're good? All right. First and foremost, welcome this morning. I stand here today with healthcare professionals, with Chairwoman Mcrae, and members of the Baltimore Police Department. At the start of the pandemic, as a state delegate, I called on the Governor Larry Hogan, as well as the Maryland Department of Health, to look at the impact of the coronavirus, not just as in aggregate, but to break the data down, specifically as it relates to ethnicity and race and zip codes. And the reason we wanted to do that was to ensure that we were able, with a scarcity of resources and the level of uncertainty of the coronavirus and its impact, address the major needs of our citizens. And today we stand here today and we understand and know that the rates of African Americans to their counterparts of mental health illness in this country is about the same. We know that during normal circumstances, suicide rates amongst African Americans are lower than other Americans. We know that for a fact. But we know during this peak of the pandemic that African American suicide rates doubled while their counterparts decreased. And you know, when I took over as president of the City Council, I talked about the idea of utilizing data and trying to develop legislation, and that's exactly what we're here for today. Many residents have suffered through this pandemic, be it the elderly community that has been secluded in their homes because of fear of contracting the virus, or young folks who no longer have the socio-emotional support of going to school and sometimes being taken out of vulnerable situations, or to their parents and their loved ones who have to navigate through an anemic mass transit system to go to work because they're essential employees without proper PPE. These are the conditions that our city has faced. These are the conditions that our residents have faced. And this is why we're here today to create Baltimore City Suicide Prevention Legislative Work Group. The work group will be co-chaired by two individuals that you'll hear from later. Council member, Chairwoman Danielle Mcrae. She's chair of the Health and Environment and Technology Committee, as well as Dr. Cynthia Major Lewis, the director of Johns Hopkins Adult Psychiatric Emergency Services. The purpose of this work group will be set up for a couple reasons. One, to make meaningful and impactful policy recommendations to us as the Baltimore City Council, to our state delegation, as well as to our federal partners. Focus on quality of care people receive over time in the city of Baltimore. Identify gaps in services, evaluate ways of increasing access to mental health, and work towards the destigmatization of mental health treatment, especially in underserved communities. I was very alarmed at the research by Dr. Paul Nestat and his team, which was published a few weeks ago. Again, it showed that dramatic increase, a double increase of African-American suicides, completed suicides in the state of Maryland. And no longer can we sit back and just look at data like that. We must take action. And that's what today is. Today is the start of leveraging real data so we can go after real issues that are affecting real Baltimoreans. Look, we see it. We see it on the bus stops. We see it on our street corners. We understand and know folks are dealing with homelessness. We understand and know that folks are dealing with food insecurity and dealing with just the perils and struggles of everyday life. But when you exacerbate that with something like the coronavirus and this pandemic, you see the results that we are currently seeing today. With that said, I'll call up Chairwoman Danielle Mcrae, who again is a co-chair of the work group.
I want to thank President Mosby. I want to thank our BPD officers for their heroic actions earlier this month in saving 2 lives. And I just want to state that during this pandemic, our residents have been faced with heightened levels of depression, heightened levels of fear, heightened levels of anxiety. And within many of our communities, the rate of suicide, it has increased. There's a stigma within many of our communities just in speaking about mental health and simply just having a conversation about mental health. And we have to do a better job collectively in making sure that suicide prevention is a priority. Suicide is preventable. And I want to say that again, suicide is preventable. And I'm honored and I look forward to co-chairing alongside Dr. Major Lewis and working together with Council President Mosby and members of the Baltimore Suicide Prevention Legislative Work Group to come up with meaningful legislation to prevent and increase awareness around suicide prevention. Thank you.
Next up, we're going to hear from Dr. Cynthia Major Lewis of Johns Hopkins.
Thank you. Thank you, Council President Mosby and Councilwoman McCrae. My name is Dr. Cynthia Major Lewis. I'm an assistant professor and I'm the director of the Psychiatric Emergency Services at Johns Hopkins Hospital. I am honored to be asked to be part of this task force. You know, as a clinician, I see firsthand the impact of untreated mental illness and undertreated mental illness, the impact that that has on our communities, our families, our children. I am concerned that as a clinician, we only have so many tools available to us. We can treat, we can encourage, but we really need legislators, we need the dollars, the resources to be able to put into, to play the things that are going to need to be done to improve the, the suicide rates, the untreated mental illness. I look forward to working with Councilwoman McCrae, and again, I want to be part of the village that's actually taking action. I don't want to be part of something that we're just talking about it. I think that the pandemic and the death of George Floyd has really helped to shine a light on systemic racism. I know the APA has actually started to look at systemic racism, and we know that we can no longer just turn a blind eye. You know, action needs to be done. Suicide is the 10th leading cause of death. And recently we've seen that there has been increased rates in our Black youth, where it's now the 2nd leading cause of death in the 10 to 14 age group, and the 4th leading cause of death in the 15 to 34. So we can no longer sit on the sidelines. You know, as a clinician, again, I know how to treat mental illness. I know what we need to do, but there's only so much that can be done. And I'm honored to work with you all so that we can really put some action to words and improve these outcomes, because it is, you know, we have a global pandemic of COVID-19, but we have an epidemic that's gone unnoticed and for too long, and we need to do something about that. So I'm honored. Thank you for asking me to be part of this task force.
Thank you, Dr. Cynthia Major Lewis. It's been widely reported and known that the research that was done by Dr. Nastat was one of the first of its kind in our country's history. Again, not just looking at data from an aggregate perspective, but drilling down on it, particularly as it relates to tying something like completed suicides to an issue. Dr. Nastat couldn't be here today. However, a person that worked with him side by side and is an amazing researcher, Mr. Michael Bray, is here today to talk about the study and the follow-ups and what they were able to conclude from their reporting. Mr. Bray.
All right. I want to thank you for the opportunity to speak today. My name is Michael Bray, and I'm a medical student and mental health researcher at Johns Hopkins University. Speaking both professionally and personally, it inspires hope to see policy leaders prioritizing actionable mental health solutions. Over the past few months, I've been a part of a team at Johns Hopkins here in Baltimore, trying to understand the impact of COVID-19 on suicide mortality. Since the beginning of the pandemic, suicidologists have been predicting that the increased social stressors, financial stressors, and psychological stressors would lead to an alarming spike in deaths by suicide. But when we first looked at the data from right here in Maryland, we were surprised to find that suicide had, in fact, decreased as folks hunkered down across the pandemic. However, when we separated the data by race, it told a very different story. And a far more complicated one. While in white Marylanders, we found that deaths by suicide were nearly cut in half during the first spring wave of COVID-19, we found that in Black Marylanders, the opposite was true. In fact, compared to previous years, suicide mortality appeared to nearly double in Black folks as compared to previous years. Now, while it may be encouraging that suicide has decreased among some groups, it's becoming clearer that Black Marylanders and other vulnerable groups may be at the greatest risk during this pandemic, and our data adds further support to that. There's still a great deal of work to do to fully understand all the intricacies as to why this disparity exists and to address it. But it's increasingly apparent that racial equity must be a key part of any effective suicide prevention strategy. Now, I want to give credit to the leader of this work, Dr. Paul Nastat, who said that when it comes to our mental health, it's true that we're all in this storm together, but we're not all in the same boat. What that means is that while these lockdowns are necessary to prevent viral deaths, it's also necessary that we as a community recognize that our experiences are different and take care of one another. Understanding that, I'm encouraged to see that our city and its leaders are coming together to create solutions that work for everyone, including the most vulnerable. Now, before I finish, I want to mention this. Suicide is usually the result of a combination of clinical illness, like depression, and increasing external stressors like we're seeing during this pandemic. Now, depression is treatable, and effective treatment, effective help is available. If you or someone you love is feeling this way, you can be connected to care by dialing 211. And in a crisis, when suicidal thoughts are increasing, this is a medical emergency, just like any other medical emergency, just like a heart attack, and it is absolutely appropriate to go to the ER. This pandemic has been hard on everyone, but there is hope, and we can and will get through this together. Thank you.
So after we were able to see the data, read the reports about the data, unfortunately, a video went viral about a situation right here in the city of Baltimore. And we were reminded of the urgency of mental health crisis when we saw that Christmas video and the heroic actions of the Baltimore Police Department. It prides me to be the president of the Baltimore City Council and see those heroic actions. Individuals who went outside of their call of duty, but saw the sanctity of life, the care of life, and the urgency of that particular time as they rescued a young 34-year-old mother who was going through a mental health crisis while attempting to commit suicide of herself and homicide of her child, 6 years old child. That is when Officer Joel Quillen, Tyler Nakari Mueller, and Jeffrey Hooper heroically again jumped into the frigid temperatures of the Baltimore harbor to save them. Our officers also endure so much mental anguish on a job on a daily basis, being put in situations such as this. I recognize that secondary trauma that they experience, and I'm committed to support our officers in that light. We must do more to support our officers, like we must do more to support our citizens and all first responders. We must ensure the time of one of our neighbors experiencing behavioral health crisis, that there's appropriate response, and we must ensure that appropriate and supportive responses of behavioral health crisis is part of this work group's charge. I'm here to tell Officer Quillen, it's Quillen, is that right?
Yes, sir.
Thank you again from the bottom of my heart, and I would like to present you with a Baltimore City Council resolution. I'm going to read it and ask that Chairwoman McCrae come over and help me present it. The City of Baltimore resolution, be it hereby known to all, the City Council of Baltimore offers its sincerest appreciation to Officer Joel Quillen in recognition of your heroism displayed on December the 13th, 2020 in saving the lives of 6-year-old child and her 34-year-old mother. This entire membership extends its best wishes on this memorable occasion and directs this resolution to be presented on this day, the 15th of January, 2021, signed by myself, President of the Baltimore City Council. Thank you so much, sir.
Thank you.
Hold it up. Thank you so much, sir.
Thank you.
Thank you.
Appreciate it.
Now, as I discussed, there were 2 other officers that were there, and we also have citations for them. And the Major Conway is here to accept it for Officer Nakari Mueller as well as Officer Hooper. So thank you so much for your leadership,
Yes,
Major.
Thank you, sir.
At this time, we'll conclude the press conference. I'll ask folks to utilize the hashtag #BeMoreStayWell to stay updated on the developments of the work group, as well as our findings and the recommendations to the Baltimore City Council, state delegation, as well as our federal partners. At this time, I'll take any questions. Yes, totally. You know, our police department, they are the first responders. You know, we constantly talk about, unfortunately, the roles and responsibilities of the police have kind of morphed and grown significantly over time. How they are not mental health experts, they should at least be able to kind of detect and understand and know the services that are available to our citizens. So we definitely look to partner with the Baltimore Police Department and have their input and inclusion on the work group. If you could hold on and wait for any questions that aren't germane to this work group till after. So is this specifically about the work group?
No, I asked my question about the work group.
Okay, well, let everybody else have a chance to ask their questions. Are there any additional questions or concerns? All right, hold on one second, please. Thank you so much.
You got it. Thank you so much. Thank you, sir. Thank you, sir. Appreciate you. Thank you.
Thank you so much. Go ahead, ask your question.
I wanted to ask you about how your office is coming together. Do you have plans to hire additional positions outside of this 9 new ones? If so, what's that progress? Will that be in your budget?
No, there aren't any plans to hire at this point. At this point, no, there aren't any plans.
How are the 9?
It's still, we're still talking with the administration. We're still talking with the administration.
You haven't provided a lot of information to your station on that topic, so I could we follow up with a phone call if you had any more specifics, but we don't have an update on the 9 positions. Okay, that's fine. That's all I was asking.
Yeah. Thank you so much, Alexis. Everybody good? All right, thanks a million.